If you're over 40, the risk of high blood pressure goes up. It's a major public health problem. So today, we are going to explain what high blood pressure symptoms are and what causes it. Also, we'll give you only 2 actionable tips on how to lower your blood pressure risk after age 40. So, keep watching. To put it simply, high blood pressure, also called hypertension, is a common disease that develops when blood flows through your arteries at higher than normal pressures. It's dangerous because it makes the heart work harder to pump blood out to the body, which can lead to atherosclerosis, stroke, kidney disease, or heart failure. But how can you tell if your blood pressure is too high? So, normal blood pressure is less than 120/80. Elevated blood pressure ranges between 120/80 and 129/80. High blood pressure is 130/80 and goes higher. So, if your blood pressure reaches the high range, you should see your doctor, especially if you have other risk factors such as diabetes or heart disease, and talk about lifestyle changes. We'll talk about effective solutions to normalize your blood pressure shortly. But let's see if there are some symptoms that can be seen as red flags. First of all, keep in mind that most people don't feel any symptoms. That's why you have to stay aware. To avoid any risk, ask your doctor for more frequent readings and keep your blood pressure on the track. If you notice that the blood pressure is really high or unusually low, record them in a journal. Write down your numbers, your activities, and how long it took for the number to reach the norm again. This information will help you and your doctor detect a pattern or a problem. But if you have such symptoms as headache, dizziness, shortness of breath, nausea, or even blurred vision, there is a chance that your blood pressure is reaching the limits, and you have to call your doctor immediately. But what are the causes of high blood pressure? Well, high blood pressure tends to develop gradually over many years. The risk of high blood pressure increases as you age. Our blood vessels naturally thicken and stiffen over time. Until about age 64, high blood pressure is more common among men. Women are more likely to develop it after age 65. Also, your lifestyle choices control your blood pressure, let's say dramatically. For instance, if you're overweight or obese, the more you weigh, the more blood you need to supply oxygen and nutrients to your tissues. As the amount of blood flow through your blood vessels increases, so does the pressure on your artery walls. Another cause that is closely connected with being overweight is the lack of physical activity. People who are inactive tend to have higher heart rates. The higher your heart rate, the harder your heart must work with each contraction, and the stronger the force on your arteries. Another key factor for high blood pressure: high levels of stress. If you constantly confront stressful situations in your life, it can lead to a temporary increase in blood pressure. Stress-related habits such as eating more, using tobacco, or drinking alcohol can lead to further increases in blood pressure. We know that high blood pressure might sound frightening, but you can help your body manage it by making some lifestyle changes that help you get healthy and stay healthy. So, our first tip on how to lower high blood pressure: start exercising regularly. Researchers say increasing the amount of exercise you do in a week can lower your risk of high blood pressure after age 40. You need to exercise more when you are younger. But remember, if you're a beginner to exercise, talk to your doctor before starting any new exercise routines, and take it slowly. Starting out at a high-intensity level could be dangerous, especially in people with uncontrolled blood pressure. Start from having 30 minutes of long exercise or take long walks in the park. Simple as that. Our tip number 2, start making changes to your eating habits. Salty and sugary foods and foods high in saturated fats can increase blood pressure. Try to avoid them and instead eat more fruits, vegetables, lean protein, and whole grains. We recommend eating more salmon or other fatty fish you like because they are an excellent source of omega-3 fatty acids that may help reduce blood pressure levels. As you can see, physical activity and food are super important for lowering your blood pressure risk. But one of the essential things is to regularly monitor your blood pressure. Unusual highs and lows may predict future problems, so monitor your numbers regularly to catch problems early. Your doctor may prescribe medication to help regulate your blood pressure if lifestyle changes aren't adequate. Even though making healthy lifestyle changes may sound challenging, it will definitely help you avoid blood pressure-related problems. If you want to know how to be more active and improve your health, check out the video Should you work out while doing intermittent fasting? And those who often have high levels of stress, you might be interested in finding out how to break free from emotional eating. Thanks for watching, and don't forget to hit the subscribe button and share your own experience in the comments below.